oropharyngeal, nasopharyngeal, and nasotracheal suctioning. The purpose of this to remove secretions that obstruct the airway and also to abstain secretions for diagnosis purposes. And also, suctionings are done clear secretions mucus from the throat if unstable to cough them up or swallow. So for the assessment, assess the client signs including the needs of suctioning, restlessness, anxiety, noise respiration, adventitious abnormal breath sounds with the chest. Also check the mental status. So sir, do you have any history of face surgery or head trauma on your face? Then next, check the vital sign of my patient. Next is the adventitious abnormal breath sounds when the chest is auscultate. Also check the oxygen saturation. So suctioning should be performed only when necessary to prevent unnecessary tissue trauma. And also inspect the fingernails and skin color in upper and lower extremities. For planning, familiarize with equipments available to prevent safety and prevent hazards that may arise during the procedure. Next is introduce yourself briefly to the client, identify using emergency protocol, explain to the client what we're going to do, why it is necessary, and how the client can participate, and also discuss how the results will be used in planning further care. Good morning, sir. My name is Ritzel May Tumbaga from NDDU Student Nurse. Can you state your name, age, and date of birth? Okay, thank you, sir. So, nandito po ako ngayon po, sir, para sa suctioning po ninyo as per the doctor's order po ito. So, kanina procedure, sir, di ni siya sakit pero uncomfortable ra kaani. So, ang buhato nako, sir, is mag-insert nako ang suctioning catheter sa imong ilong or sa imong baba. So, sir, medyo makasuka kaani, sir, or mag-ubo-ubo sad ka. Pero, sir, ayaw ka bala ka, sir, kay normal ra ni siya sa atong procedure. So, karing procedure, sir, is very important, especially sa imong case, sir, para ma-remove nato ang mga secretions sa oro and nasal nimo, sir, para makaginhawa kag tarong. So, knowing that the procedures will be relieve breathing problem and often ensuring and less the client cooperation. Next is perform hand hygiene for infections protocol. Next is provide the client privacy to less anxiety. So, sir, magsarado lang kong curtains. So, sir, mag-semi-fowler position ta, sir. So, assist na lang ka, sir, ha? So, these positions is facilitate the circulations of catheter and help prevent aspirations of circulation. And also positions with the head turned to one side for oral suctioning. Also positions the unstable client with the lateral positions facing you. The lateral positions also facilitates drain of secretion from the parents and prevent the possibles of aspiration. Next is place the towel or moisture resistant pad over the pillow or under the chin. Pick up the sterile container and pour sterile saline into the sterile container. And also prepare the equipment, turn on suctions device on and set to appropriate narrative pressures on the suctions gauge. Do sterile gloves, keeping the non-dominant hand sterile, prevent contaminating the upper airway with a unsterile suctions catheter. Next is pick up the suction catheter with your non-dominant and attach it to the connecting tube. And put the tips of suction catheter into the sterile container of saline solution and suction a small amount of saline solution through the suction catheter. So first is we need to measure the distance between the edge of the patient's mouth and the tips of the patient's earlobe. And also measure the distance between the tips of the patient's nose and the tips of the patient's earlobe. Using your non-dominant hand, remove the oxygen delivery device if present. Moist the tips of the suction catheter with a sterile water or saline. Using a non-dominant hand, gently but quickly insert the suction catheter along the sides of the patient's mouth into the oropharynx. Advance the catheter between 10 to 15 cm for 4 to 6 inch. Next is the nasopharyngeal and nasotracheal. Lubricate the catheter tips with the water-soluble lubricant. Using a non-dominant hand, gently but quickly insert the suction catheter into the nares. So for suctions, attempt should last only 10 to 15 seconds during time the catheter is inserted. The suctioning applied and discontinue and the catheter removed. Rinse and flush the catheter and tubing with sterile water or saline. Encourage the client to breathe deeply and cough between suction. Next is obtain the vestments if required. Attach the suction catheter to the tubing of the scrotum tip. Touch the suction tubing to the scrotum tip's air vent. So the scrotum traps will collect the mucus during suctioning. Reconnect the suction catheter to the tubing. Flush the catheter to remove secretion for tubing. Turn off the suction machine and dispose the catheter, gloves, water, and waste container. Coil the suction catheter with your dominant hand. Pull the catheter gloves over the coiled catheter. Discard the gloves containing the catheter in a biohazard receptacle designated by your agency. Next is promote client comfort. Assist the client to positions that facilitates breathing. To give my comfort of my patients, I wipe the face or her nose and mouth. Assist the client to positions that facilitate breathing. This promote patient's comfort. And next is dispose equipments and ensures availability for the next suction. And also change the suction tube and container daily. Ensures that the supplies are available for the next suction. And also perform hand hygiene for infections protocol. So sir, i-auscultate ko lang po ang breath sounds nyo po. And also observe the skin color, level of anxiety, and oxygen saturation level. Then sir, I want to check lang po sa skin color ninyo po sa upper and lower extremities. For the rationale of this po is to determine effective of the procedure. For documentations, record the procedures, the amount, frequency, color, and order of the sputum. Suction name patient B, date of suctions November 2001, time 8 a.m. Large amount of foamy white mucus to back of oral pharynx but allow it to speak 2009. To twice use suctions catheter from 87% before suction to 93% after suction. Blood pressure back to normal from 110/70 to 120/81 after suctioning. RR also increased from 10 beat per minute to 18 beat per minute lungs. Clear to consultation throughout all lobby. Patient narrative, medyo may pagkagaspang or katul sa akong tutunlan pero karon murag wala na. Oropharyngeal, nasopharyngeal, and nasotracheal done by Ritzel May Tumbaga.